Good morning, good afternoon, good evening, and welcome to the latest of our award-winning webinars. I'm Iain Fitzpatrick, Chief Strategy Officer at Archetype. We work with clients in the workplace benefits and people development spaces. We provide growth consulting services that we use to identify opportunities for investments that we make out of our own fund. Absolutely delighted to be joined today by Hazel Wheldon. Hazel is the Chief Executive of Multi-Health Systems, a global leader in the development of innovative, easy for you to say, scientifically validated assessments that help improve the lives of individuals and communities around the world. Archetype was also very fortunate to include Hazel in our cadre of wonderful advisors to the firm. Welcome, Hazel.
Thank you, Iain. It's a pleasure to be here.
Okay. Our topic today is how developments in digital health create opportunities for health equity and greater social justice. I know these are topics that are extremely important to you, Hazel, and you've in fact dedicated your professional life towards addressing those. So I guess it makes sense to start at the macro level and talk about how the global COVID pandemic has impacted the digital health landscape and what that means in particular for underserved communities.
Thanks, Iain. Yes, the pandemic certainly accelerated digital transformation for many industries, and health was one of those. One of the biggest leverages for increasing access was the removal of some of the requirements around state barriers for practicing medicine, and being able to do digital health across state boundaries, which definitely worked to increase access. One of the things, though, about digital telehealth, digital therapy, digital mental health is that we can't assume that just because we move into the digital world that we're actually going to increase access. It is something that you certainly have to work at. It's something that you have to dedicate resources to understand the needs of the underserved communities around you and how digital technology can be leveraged. When we view the world from our own lens, where we might have really good, reliable Wi-Fi or stable cell networks that give us easy access to technology, that's not necessarily true of everybody, even in North America, and certainly less true for people around the world. So we have to ensure that we understand the access needs, we understand the technologies that people have available to them in order to use that. If we do that, then we can definitely leverage digital health to increase access, improve efficiency, and create opportunities. And if we look at access in particular, there are three barriers to people accessing digital health and healthcare in general, and that they revolve around the cost of healthcare and the cost of digital access with cell phone plans, data plans, all of those things. But also, one of the areas where technology has the opportunity to make a huge difference is in removing the need to take time off work to access healthcare. The US is the only major world economy that doesn't guarantee paid time off. And that's particularly true for people in lower paid or unstable work situations, where they are much less likely to have paid time off, and taking time off can have a huge economic impact on them. And while it's easier for people to take time off for urgent healthcare situations, preventative healthcare, including mental health, doesn't get the priority, doesn't take precedence over the need to work and put food on the table. And so what becomes a half-hour half day off to access mental health care in person can become a 15 to 30-minute phone call on a lunch break in a private area at your workplace. And so the opportunity to participate in those types of care systems is greatly increased because of the reduction in cost. And making sure that healthcare providers consider that people won't always have a private place to go, that they might not always have the ability for data to use a Zoom link, that there has to be an opportunity for low data or no data technology applications as well. And if we think these things through from end to end, we can do a great deal to improve access and to provide greater opportunities for people to participate in the mental health and in the physical health systems. The one challenge that digital health still struggles to solve is that of scaling. Person-to-person treatments require enough service providers, enough mental health therapists, enough psychologists, enough doctors, enough nurse practitioners, whatever resource we are using. Where I think we can gain some efficiency in the system is it's using digital tools for screening, using chatbots, digitizing intake forms, digitizing other screening tools that allow for a lot of the pre-work to be done in a digital format, then giving the practitioner far more time to spend with patients on the real needs. So for example, if you're taking your child to a psychologist for a mental health issue, if all of the pre-screening forms and the psychological assessments that can be done digitally are done in advance, the psychologist can then use the computer system to score those, generate ideas of where the problems are, and then the very first meeting, whether it be face-to-face or through technology, can be spent on actual treatment and actual conversation about the problem, rather than on gathering information and doing the background work. That way, the patient's only paying for the in-person time. The therapist is gaining efficiency and can see more patients in a day. And we've leveraged digital technology to automate some of the data collection work that goes into any healthcare system.
Thanks. Yeah, so, I mean, just reflecting back, saying there, so, I mean, the pandemic has removed certain barriers that existed to how we could access healthcare. Those are, changes to regulations and what have you. Those are barriers that aren't coming back, certainly not to the extent that they were there before. And that provides opportunity, but I almost lost count of the times that you used the word opportunity. It's an opportunity, not yet a reality that we've grabbed with both hands. But the opportunity is there to use the acceleration of digital health to make an enormous difference to how underserved communities access healthcare and deliver better outcomes.
Yeah, and it has to be done with intention, Iain. I think that's the biggest point there, that we have to examine. As I said right in the very beginning, we can't assume that digital automatically increases access, that we have to act with an intention to understand what the access barriers are, even in digital health, for underserved communities and low-income communities.
Right. I'd like to talk a bit about the, let's say, the interplay between digital health products and broader health solutions, again, with a focus on how this can have a disproportionate impact on underserved communities. Just by, we have examples, spoke to a CEO of a wonderful digital health product this week. Our product allows you to take a full, essentially a map of your skin in order to create opportunities to get test for skin cancer, which is the most common cancer, certainly here in the US. And asking her about her challenges for the future, her direct quote was that we're a point solution in a sea of point solutions. So there's, again, as you've talked about that transformation of the digital health space, there's a lot of truly wonderful offers out there, but they are point solutions, and not yet often connected into broader health solutions. So maybe you can talk about that distinction and again how that impacts underserved communities.
Absolutely, Ian. In our business, we have a saying that we don't want to be a test provider in a solutions marketplace. The idea being that there are lots of stand-alone, one-off products out there, but what people need are to connect those products into solutions. Gartner in 2020 released a digital workplace productivity report, and they discovered that 61% of professionals' time is spent in wasted effort, swiveling between platforms, between systems, between different technologies to collect information and to do their job. And as a result of this, I think there's a strong desire for systems and experiences that place all the tools an individuals need in one place, reduce that a swivel seat. Again, to use an industry example or an example that's relevant to MHS and its customers, that same parent who's taking their child to a psychologist for mental health or a learning issue, the psychologist will use assessment tools from multiple providers. Each of those providers right now has their own login system, their own URL, their own password requirements, their own links to send emails to parents with or clients with the test questions in. Then when it comes to reporting out, you have to log back into each of those systems, score the assessment, generate the report, and then you end up with 5 or 6 reports from different assessments that are in isolation, and you have to spend mental effort and energy to review those reports, find the common links, and figure out what the potential diagnosis or the issues or challenges are that you want to address. And so we make it inordinately difficult for our customers and then for their clients, because for the parent, then it's opening up 5 different emails, clicking on those 5 different email links, completing one set of questions, and then exiting that, opening up an email with another link, etc. All of that takes time, effort, it takes data, it takes internet access, it takes all of those things that we know are challenges for underserved communities. And from a healthcare organization perspective, solutions allow CEOs to unlock value by partnering with others to create an ecosystem. We get that opportunity for 2 + 2 = 5 or even more. You take the skincare mapping, for example, and you combine that with other technology that maybe does family histories or links into an EHR with any additional scans or information for that patient. The technology can put that all together and make a seamless experience for the physician that incorporates multiple data points into helping them understand the client. You create a value proposition for the client, you build in stickiness, you build in a higher barrier to entry for competitors, and in return, your investment is returned multiple times. And so it's sometimes hard to, as a leader of an organization, to say we're better off to work with our competitors or cooperate than we are to compete. But I truly believe that there's much more value to be unlocked under a partnership model where we lump things together to create solutions for everybody.
Thank you, Taylor. I mentioned by way of introduction that you spent your entire career connected to health equity and social justice issues. And I'd like to ask you to illustrate some of the points you've been making so far with some specific examples. And You have examples to share that talk to both your extensive history and experience in the space, but also demonstrate your position, the vanguard of what comes next. So I'd invite you to illustrate through a couple of examples.
Thanks, Ian. Some of my early work as a school psychologist. So for those who don't know me, I was a practicing psychometrist, school psychologist in Ontario, Canada, and in Singapore. But a lot of my early work was with First Nations and Indigenous communities in Canada. And here in Canada, Indigenous communities are disproportionately represented in the criminal justice system. They're more likely to be arrested, they're more likely to be incarcerated, and they're more likely to get longer sentences when they are incarcerated. And offender management in general across North America is heavily disproportionately positioned to incarcerate minority communities. The typical profile of an offender is male, minority or marginalized community, under 24, and a high school dropout. And our systems treat offenders as people with no value who need to be managed without any input in and of themselves. The problem is that recidivism rates for this population are in the 60% range for the first year. So more than 60% of offenders reoffend within the first year of getting out of jail or from being incarcerated. And so even when authorities spend money on offenders, it's not in including them in the system, it's in adding headcount. It's in adding more probation officers, more parole officers, more police officers, more people to manage these people. These are high cost resources with high turnover rates in the jobs and burnout. And so when we look at all of this, I see the opportunity to really disrupt this industry, to really make a change and make a difference. After all, one of the purposes of incarceration is to find an opportunity to treat that individual, to help them to identify the things that are risk for them to reoffend and to offer treatment. It's not solely about locking them up and throwing away the key and forgetting about them. But in order to do that, we need to change our framework. We need to change our way of thinking, and we need to involve the offender in their solution. And so our goal is to reduce recidivism by increasing compliance and creating engagement with the offender themselves and including them in their case management, their treatment plan. And we can do that with digital technology, where we can use smartphone apps to connect with offenders, to upload their probation and parole conditions, to give them support, to help them access education, to get their GED, to schedule their appointments with their probation parole officer, to be able to schedule appointments with their AA group or their counselor or their mental health therapist, all of those kinds of things. But new technologies also allow us to include the offender support community in those data collection and support efforts with their consent and their permission, including the spouse, including the employer in the care solution for that offender. If we do a lot of that work digitally, particularly with low-risk offenders, we can increase the opportunity for them to participate. We can engage them in setting priorities around their own treatment needs and including them in the treatment protocol. We can do it digitally, which reduces the amount of time they have to take time off and the stigma associated with that, taking that time off. Not everyone wants to go to their employer and say, I need 2 hours off this afternoon to check in with my probation or parole officer. But again, if they can check in digitally through on their lunch break and provide all the information that the probation and parole officer needs to understand this individual is satisfying their probation or parole conditions, then that relieves the stress on everybody in the system. It gives the probation and parole officer more time to spend with high-risk offenders. It changes the nature of the conversation. When they do check in person, it no longer becomes a data collection check-in. Have you been to work? Have you gone to your AA meetings? Have you stayed away from this person? Have you remembered to do this? All that information has been collected digitally. And then the conversation can be, you're doing great. What else can I do to support you? What else do you need to feel that a greater probability of success? What other resources can we help you access? And just changing the nature of that conversation alone treats the offender with respect, includes them in the process, makes them feel like they're valued. And that will increase their compliance, which in turn will reduce recidivism. These, after all, are human beings. They may have done some things that aren't things that society endorses, but they're fundamentally human beings with the opportunity to succeed if we give them all the support that they need. And in return, what the probation parole officer and the system gets is more data, more time for probation and parole officers, less administrative work, less burnout and stress on the behalf of those probation and parole officers, because they're also more engaged in the conversations that they have with the offenders, and a greater ability to have an impact on society as a whole. It costs well over $75,000 a year to house an offender in most states. Digital technology can help manage those offenders for less than $500 a year. And that cost efficiency, those cost savings can be applied to provide more education support. We know that having a GED is a precursor to getting many jobs, which is a great moderator for recidivism. So if you're working and you're earning income, you're less likely to commit crimes and to go back into the system. So there's so many opportunities to disrupt, and we're seeing great engagement from criminal justice systems around the US, some of the leading states that have always been on the forefront of the criminal justice reform and finding new ways to support offenders and to make communities safer are really coming around to this way of thinking, and we're excited to participate in this kind of disruption. It's an exciting opportunity.
Thanks for sharing, Hazel. Consumers of our insights always appreciate concrete actions they can take away from these types of discussions. So I'd like to ask you to distill your experience into, in tackling health equity and social justice via digital health, into some takeaways that people who are, tackling the same challenges that you're talking about, what are the sort of takeaways that they can have from today's discussion?
One thing that I sort of touched on, but really needs to be reinforced is going back to that, digital systems collect a lot of data. So you just really need to understand where the opportunity for bias creeps into data. Data in itself is not biased, but algorithms that we generate can easily have bias in them. And so paying attention, don't assume that digital technology is in itself unbiased. Very often it can make bias worse if it's left untouched or unsupervised or unmonitored. The second piece is a partner. Don't reinvent the wheel. There are lots of companies out there. And as I stated before, I believe that by partnering, you can create value that multiplies for each person in the value chain, that 2 + 2 really does equal 5 or 7, or in some cases, even 10. In our criminal justice initiatives, we're partnering with people like Microsoft, with a company out of Ireland, Core Systems Technologies, who are doing some great work with offender apps, with a company, Iain, from your own portfolio, Kith and Kin, who has some technology that we believe can be used to incorporate multiple community and family members into the offender treatment plan with their consent and permission. And the last one is just jump in, just give it a shot, try it, don't be afraid. We talk about failure being first attempt in learning. as long as your intentions are good, your effort is focused on the right things, you follow out the potential unintended consequences of your actions. Failure just gives you an opportunity to learn and grow and find the right path forward.
Thanks for sharing those, Hazel. I'm just going into the chat here, the questions. If a question come in, so it's, how do I get my organization to be more open to adopt the principles outlined? So, if I paraphrase that question, you've talked a lot there, and you're summarising there, partnership over proprietary, but that's often counterintuitive to organisations, you say, that are looking for competitive advantage and maybe even in sustainable competitive advantage. So, how is it that we as leaders in organizations get our organizations to be more open to what you're talking about?
Well, the first thing I'll say is, as leaders, we need to drop the ego, lead with emotional intelligence, lead with empathy. And it's often difficult to understand the opportunities that exist inside your organization, or to set aside time to figure out where to innovate, how to innovate, who to innovate with. And one of the things that we did was we connected with Archetype many years ago, and brought Archetype in as a consultant to help us understand how we could innovate in our organization. And there are lots of things to watch out for. Sometimes it's a matter of the people who are working on the innovation project or the innovation team are seen as being separate or distinct or special in some way, and maybe resented by others in the organization. Or it may be that everybody wants to be in that part and nobody wants to work on the regular products. But that's a leader's job to manage those things. That's what we get paid as CEOs to do, is to help people understand why we're taking these initiatives, why we're doing these things, and what the benefit for all is. But I don't think that many organizations can do it by themselves. I think bringing in the right consulting partner, having the right conversations, understanding the challenges and potential pitfalls, and then building a plan to manage those requires support from outside the organization.
Thank you, Hazel. Well, we're up on time here, so I'll just close off by saying again, thank you. Thank you for the terrific work you do, your organisation does, and under your terrific leadership. And thank you for the ongoing support you provide to us as an organisation. It's been a pleasure to connect with you today, and I hope we've been able to sort of share some insights and thoughts for those in the space.
Thank you, Ian. It was a great pleasure. And without Archetype, we wouldn't have been as far along this journey as we are. So the support of your team has been helpful. Thank you.
Very kind of you to say. Okay, thanks a lot.